Later today, we'll practice the skills of two rescuer CPR. For the two rescuer practice, we'll use the bag mask device. So let's first learn how to use it. The bag mask device consists of a ventilation bag and a face mask, and it comes in a variety of sizes. You can also use supplementary oxygen with the bag mask device.
To begin, position yourself directly above the victim's head. You'll use the EC clamp technique to hold the mask in place.
To do this, place the mask on the victim's face, using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press the edges of the mask to the face. The remaining three fingers of your hand should form an E to tilt the head back, lift the jaw, and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest does not rise with each breath, then you're not providing adequate breaths.
But if this occurs, readjust the mask, reposition the head and neck, and attempt to ventilate. And then, only if necessary, administer a larger amount of air.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, each breath given over 1 second after every set of 30 compressions.
Make sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation or air going into the victim's stomach instead of his or her lungs. Gastric inflation can cause vomiting and possible aspiration. To illustrate these points, let's see that portion of the scenario again. You can see that 2 breaths are delivered. She's watching the chest rise as she delivers the breaths to confirm that they're effective, and they're delivered over 1 second with just enough volume to make the chest rise.
If you have multiple rescuers, the most effective way to deliver breaths with a bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause chest rise. The first rescuer will use both hands to seal the mask to the patient's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face. And the 3 remaining fingers of each hand will form an E, lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the patient's jaw down and block the airway. Now, it's time to practice the 1 rescuer bag mask technique so that in a few minutes we can combine it with compressions to work on a 2 rescuer sequence.
We'll pause here to get into position.